Have you ever been hit by a stomach bug that seemed to come out of nowhere, turning your world upside down for a day or two? It's a miserable experience, and chances are what you encountered might have been norovirus. In the USA, UK, and Canada, norovirus is incredibly common, especially during the colder months, and it's known for spreading rapidly through families and communities. Here at PureLifePulse, we understand how important it is to keep your loved ones healthy. And that's why today we're diving deep into the world of norovirus, revealing its symptoms, key facts, and, most importantly, providing you with practical tips to keep your family safe. When norovirus strikes, it tends to make its presence known quite quickly. Imagine feeling perfectly fine one moment, and then, seemingly out of the blue, nausea creeps in. This is often the first sign. Vomiting and watery diarrhea usually follow, sometimes accompanied by stomach cramps that can feel quite intense. You might also experience a low-grade fever, chills, and muscle aches, leaving you feeling completely drained. Unlike the flu, norovirus typically doesn't cause a high fever or significant respiratory symptoms like a cough or stuffy nose. Think of it as a fast-acting bug. Symptoms usually appear 12 to 48 hours after exposure and tend to last for about 1 to 3 days. While it's generally short-lived, those few days can be incredibly unpleasant and disruptive, especially when it spreads through an entire household. One of the most striking things about norovirus is just how contagious it is. It's often called the winter vomiting bug, because it thrives in colder temperatures and spreads easily in close quarters, like homes, schools, and care facilities. The virus is present in the vomit and stool of infected individuals, even before symptoms begin and for a few days after recovery. Transmission happens primarily through the fecal-oral route, which might sound technical, but it simply means that tiny, invisible virus particles can get into your mouth from contaminated surfaces, food, or drinks. Think about touching a doorknob handled by someone with norovirus who didn't wash their hands properly, or eating food prepared by an infected person. Norovirus particles are incredibly resilient and can survive on surfaces for days, making thorough cleaning and disinfection crucial. Another key fact is that you can get norovirus multiple times in your life. Having it once doesn't make you immune forever, as there are many different strains of norovirus, and immunity is strain-specific and temporary. So, how do you protect yourself and your family from this unwelcome visitor? The cornerstone of norovirus prevention is, without a doubt, hand hygiene. Washing your hands thoroughly with soap and water for at least 20 seconds, think humming happy birthday twice, is your first line of defense. Make sure to scrub all surfaces of your hands, including under your nails and between your fingers, and dry them properly with a clean towel or air dry. Hand sanitizers can be helpful, but they are not as effective against norovirus as good old soap and water, especially if hands are visibly soiled. Beyond hand washing, surface disinfection is key. Norovirus can linger on surfaces, so regularly cleaning and disinfecting frequently touched areas like countertops, doorknobs, light switches, and bathroom surfaces is essential, particularly if someone in your household is sick. Use a bleach-based cleaner or a disinfectant effective against norovirus, following the product instructions carefully. Food safety is another critical aspect. Rinse fruits and vegetables thoroughly under running water and cook shellfish and other seafood to safe internal temperatures. If someone in your home is ill, be extra cautious with food preparation and avoid sharing utensils and dishes. It's also wise to wash laundry thoroughly, especially bedding and clothing that might be contaminated with vomit or stool. Handle soiled items carefully, wearing gloves if possible, and wash them in hot water. If someone in your family does get sick with norovirus, the best approach is to isolate them as much as possible to prevent further spread. Encourage them to stay in a separate room and use a separate bathroom if feasible. Make sure they stay well hydrated by drinking plenty of clear fluids like water, broth, or electrolyte solutions, as dehydration is a common complication of norovirus. Avoid sugary drinks, as they can sometimes worsen diarrhea. And remember, antibiotics are ineffective against viruses like norovirus. Treatment focuses on managing symptoms and preventing dehydration. You know, it's interesting to note that norovirus outbreaks often peak during the winter months, but they can occur year-round. Places where people are in close proximity, such as cruise ships, schools, and nursing homes, are particularly susceptible to outbreaks. While norovirus can affect anyone, young children, the elderly, and individuals with weakened immune systems are at higher risk of experiencing more severe symptoms and complications. It's also worth mentioning that sometimes people recover from norovirus but can still shed the virus for a short period, meaning they can still be contagious even after feeling better. This highlights the importance of maintaining good hygiene practices even after symptoms subside to prevent further spread within your community. Would you believe that researchers are continuously working on developing a norovirus vaccine? While not yet widely available, this could be a game changer in the future for preventing outbreaks and protecting vulnerable populations. Keeping norovirus at bay really comes down to consistent hygiene practices and being mindful of how easily it spreads. We hope this information from PureLifePulse empowers you to protect your family and stay healthy. Have you had experiences with norovirus, or do you have any additional tips that have worked for your family? We'd love to hear from you. Join the PureLifePulse community in the comments below to share your thoughts and experiences. And of course, if you have specific health concerns or questions, always consult with your healthcare provider for personalized advice. Together, we can build healthier, happier lives. Stay tuned for more evidence-based health insights from PureLifePulse.